And welcome to another edition of South Texas Senior Journal. This is Attorney Joe Flores and nurse practitioner reminding you to join us each and every week right here on KTMV. And we are also on YouTube. You can catch us on youtube.com, search term Joe Flores or South Texas Senior Journal. With me today, I have someone who's agreed to be co-host of this show, Clarissa Gonzalez. How are you?
Doing great, thank you.
Good, good, good. Well, I'm glad you're here because, you know, a lot of people have given some great reviews about the first show, very informative. Seniors are very grateful about what we've been trying to do and the message we've been getting. And now with the new health care bill, I think it's time that we talk about that issue. And who better than you that have been watching all of this and really diligently following it up and educating seniors each and every day on these things. So tell us a little bit about what we're going to be talking about today about the health care bill and how it affects Medicare.
Well, one of the first things I want to mention is the response that we had on our last show. It was amazing. We had a great amount of people that called in, different questions along the board that we were able to help people out with Medicaid, with Medicare, prescription Part D. Some people were saying, well, I've never heard about this. And so we're very, very grateful that they were able to pick up that phone and give us a call, because that's what we want to do. We want to spread the message. We want to make sure that everybody's educated when it comes to their Medicare. And it was great. It was heartfelt thank yous that we had, and it's amazing how we're able to help people, and I thank you very much for allowing the message to go out to do this show.
Well, and I appreciate you that you're going to be on here, a permanent fixture, helping us out on the show. And I think one of the things is we do have websites that are going to be appearing, and we do have great people that come out, like Linda Oliver and the people like Diana De Leon and everybody else that helps out. And I can't say enough how on seniors we need to also have people get interested in being ombudsmen. We need to have people watching out for those people in long-term care facilities, because Medicare is impacted, so is Medicaid. And our last show, you talked about the differences in each part, Part A, Part B, and also Part D. You talked about Medicare differences. You talked about the difference between Medicare and Medicaid. Now we're kind of looking at it and zooming out. You did take a trip to Washington.
Yes.
And you met with a congressman on issues also involving the elderly and Medicare. I believe you met with Congressman Henry Cuellar
as well, yes,
and with Solomon Ortiz in Washington in May. Tell us a little bit about that trip and your experiences.
Well, first of all, that trip was it was a very rewarding trip, because we go there representing the people in our community. I go there with an open mind, trying to figure out which way we're going to be able to help the seniors in our community, and not just our county, but the surrounding counties as well.
Sure.
And that is what we strive to do. We have gotten calls from people in Laredo from our show here in Nueces County. And so it's very important that we give out the right message, that we understand what's going on, and by meeting with our congressmen and by meeting with different representatives, I'm able to get the knowledge to be able to pass out to the people in this community.
Well, and you're a small business owner. You also represent not only the seniors, but you're also representing the people who essentially create 80% of the jobs, pay into Medicare through their employees. So, I mean, that has a great impact. Tell us how your career and insurance and your daily activities, you said that there was overwhelming, you know, support. You had a lot of seniors calling in. What were some of the kind of questions that they had?
Well, the majority of the questions were, you know, how can I qualify for Medicaid? A lot of the folks fall into that category where there's 4 different levels of Medicaid, and that impact the seniors. It's the full Medicaid and what is also called the Medicaid Savings Program, which is the QMB, SLMB, and QA1. So basically, some people go to Social Security Administration and they say, you know what, you make too much money to qualify for Medicaid.
Very common.
And at the same time, they don't send them to the state level and say, you know what, you can go to the Texas Department of Health and Human Services and apply for additional help. Well, we've been able to help people through the process of going to apply. Yes, they were told no at the federal level, but there are state programs available. And there are other programs available with people with low income, for example, the low income subsidy on prescriptions. And so that was one of our biggest, you know, concerns in the community that we can see, because 75% of the people that qualify for this help are not on those programs. And that number keeps getting higher and higher, because every month that goes by, more and more people keep turning 65.
Well, and you know, people like that are part of the Area Council on Aging and people helping seniors, like Linda Oliver, she called, she had some positive feedback on the show. There are also websites that are available that provide free information.
Yes.
You know, I promised her that we would bring those out. But when you went to Washington, I mean, nobody paid for you to go. You went on your own initiative.
Correct.
You went out there to meet because of the seniors and to get that information across. Let's zoom in a little bit. We have a limited amount of time, but I really wanted to talk about the health care law and, you know, the substance of what you went to talk to the congressman or congressmen about were your concerns about health care law and how it's going to impact Medicare. Are we going to go broke? What are seniors going to see? Are they going to pay more on Medicare?
You know, a lot of people don't understand, you know, the things that are going on, you know, with the Medicare and the health care bill that was signed. There's a lot of positive things that are going on, and again, you know, there's always, you know, like I said before, the good, the bad, and the ugly.
Yes.
However, when it comes to the Medicare side, by this law being, or this act being into effect, it pretty much is starting to regulate fraud a little bit more deeper, and
yes.
that's a big problem that we have, even in our community, because unfortunately, we have home health agencies that are making phone calls to disenroll people from their Medicare Advantage plans because they can't bill more than what they're used to or what have you. And it's not all home health agencies. There's a select few out there.
A few bad apples.
A few bad apples.
Yeah.
And it happens.
My wife's a home health owner, and she says there has to be more safeguards for that kind of abuse you're talking about.
And I'll tell you what, there's some people that don't even know that their home health agency called to cancel their plan. So there's that thin and fine line where there's, you know, Medicare fraud being committed there. So we have to put a stop to that. And I encourage any and all seniors out there, and even the family members, if you feel that somebody is overbilling, that somebody's, you know, that you go to a doctor's visit and there's something on that the Trailblazer report that comes back and says, you know what, I didn't get these exams done, it is our job to call in and find out, because you know what, at the end of the day, these are the things that are spending a lot of the Medicare trust fund money. And one of the things that this law or this act is going to do is going to create programs that are going to be more vigilant, and they're going to be out there, and they're going to be regulating and making sure that the fraud and the amount of things that are going on right now comes down to a lower level. Why? Because we need that particular amount of money to be able to provide for real health care issues. And another thing that's going to happen is that by doing so and by creating this act, it actually extends the life of the Medicare trust fund by 12 years. Within the next 20 years, we can expect that to happen. So within 20 years, the savings that are going to be provided are going to extend the Medicare trust fund, which is a good thing for the people that are going to be needing those benefits in the later years.